Hello, this is INET 4153 Policy Project Group Number 8, and this is my group mates Ayodeji, me, Abdulkader Shore, Isra, Shoaib, and Samuel.
Okay. First up, we have the overview. We have the access control policy. The access control policy stipulates who may have access to sensitive health data and allows access to such records only to authorized individuals. It perfectly meets all the acts of access control as stipulated under HIPAA. For the recovery plan policy, the recovery plan policy provides the regular backing up of the essential patient information and its reinstallation after a disaster. And all the services comply with the guidelines on contingency planning and backup data offered by HIPAA. For the change management policy, under this policy, care is taken about managing healthcare system changes, thus effective management of changes made to the systems storing or processing personal data guarantees data security and complies with system change control requirements by HIPAA. For the data classification policy, the data classification policy should see that the patient's data have been well classified and is hence protected in accordance with the sensitivity labeled on it, with additional precautions surrounding that to safeguard that they are not accessed without proper legal authority under the regulations advocated by HIPAA. Next up, we have the access control policy. The purpose of this policy at Clear Spring Healthcare is to provide a guideline to grant, remove, or modify access to the company's network. This policy will also provide guidance on permissions within the company network, which grants access to company data. This policy will also give guidance on user authentication and user logon. First up, we have modifications of user permissions. All requests to modify the existing permissions on a user must be approved by the lead manager. For the creation of new users, the identity of an employee must be verified before creation of a new account is permissible. And then when assigning permission to a user, permissions must be based on the principle of least privilege. The principle of least privilege is an idea that you only give permissions to a user that allows them to do their job and no more. This prevents people from having access to data they're not supposed to and hence leaking it. Next up, we have user ID and passwords. The company requires that each employee have a unique login ID and a password. Employees must also ensure their password is in accordance with the company's password policy. Passwords must never be written in plain view, stored in plain text, or shared verbally with another employee or any member of the public. Automated login to company system is strictly prohibited. Regular password changes are mandatory every 60 days, regardless of the strength of the password. And if a password has been compromised, employees must immediately notify the supervisor as soon as possible. And then for employee termination, upon termination of an employee, the system administrator must be notified to remove all permissions from the employee's account and delete the account. And then all equipment and data belonging to the company must also be returned following termination of employment.
So for computer/data systems and recovery policy, the policy of Clear Spring Healthcare is to make sure that all organizational data, including sensitive and protected health information, is regularly backed up and stored in the event of a system breach and failure, and they need to continue to maintain a reliable encrypted testing, backup, and recovery process to meet HIPAA standards and to safeguard all critical data. And the three clear objectives of this policy is to protect the data and the IT infrastructure from potential threats, and to define protocols for disaster recovery and data restoration, and to ensure compliance with industry standards for data security. And the policy controls are all critical data will be backed up with hourly basis if it is indeed necessary, and it will be done on a routine schedule, both on-site and off-site, with the secure locations to ensure safety. And all testing will be done to make sure that all things are done properly, as well as disposing old data that has well past the retention period, making sure that all data is encrypted with very strict and restricted authorized personnel only. And all employees and departments involved in management access and protection, as well as being expected to be aware of the backup and recovery policy as an employee.
I'm here to go over the change management policy. This is a policy to make sure that Clear Spring Healthcare ensures all computer data and system changes to make sure that we minimize risks, keep good system integrity, data privacy, and compliance with all the standards. All changes must go this process for requesting, reviewing, approving, testing, and implementing with backup plans with backup plans established to revert change in case of any issues. So first, we're going to talk about change requests. Change requests is that if the policy for change requests is that all system changes must be initiated with a formal request, an RFC form detailing the purpose, impact, and scope. You need all these just to make sure we have documents to make sure we can track what people want to change, and we have just formal documentation when they want to change it. Then we move on to review and approval, in which each change must be reviewed by the IT change management team and approved by the relevant stakeholders, who are the people it's going to affect, including compliance and risk management if it involves sensitive or regulated data. So if we're talking about changing a system that has data that's really important, we got to make sure that we talk to compliance and risk management before we get that done. Then we move on to testing requirements. Changes must be tested in a controlled environment to verify functionality and assess any potential impacts on existing systems and data security. So if you go to the next slide, you can see them here kind of listed and speaking to that testing requirements, but just making sure that you're not testing something blind and you're not going in not knowing what the effects to all your systems are. And backup procedures. Each change must include a backup plan or kind of a fail-safe button for immediate reversal just in case problems arise in or during or after implementation to prevent disruptions to critical healthcare services. This is really important just in case something goes wrong or something you didn't expect or something that didn't show up during the testing requirements comes about. You always have to have a backup plan or backup procedure just to make sure that you're not exposed and, mitigating the risk.
Hi, I'm here to talk about the data classification policy. The policy of Clear Spring Healthcare is to create a structured data classification system to ensure that everything is stored within the organization, secure and safe from any breaches or security issues. Classification levels are always applied to ensure that we follow the data handling guidelines and that the security protocols for each data type are secure. Any changes will be processed through requests, the ones who have access to these. Next slide. So in conclusion, these policies will ensure that ClearSpring complies with HIPAA in ensuring that patient information is further safeguarded and information assets are provided security by passing through access control, disaster recovery, and system change management data classification procedures. Thank you so much